We have one correction that Dr. Siddharth, the paper he presented was supposed to be the presentation of his last year's best free paper. So now will be the actual paper to be judged, which is free paper 318. So Dr. Siddharth may please present.
Meanwhile, we'd also like to request all the presenters to stay till the end of the session. If there is some time, we would take up some question and answers in the interest of the audience.
Sorry for the confusion. So this talk is on nucleic acid extraction-free CRISPR Cas12 based diagnostic platform, where we streamlined the process for point-of-care testing. So again, the same background on CRISPR. In one line, they are the antibody equivalents of prokaryotes. So again, there's a huge unmet need to diagnose and manage fungal keratitis at the primary healthcare level, and to add to the existing diagnostic armamentarium for the management of fungal keratitis. So our purpose was to develop a rapid, non-invasive, cost-effective point-of-care test to diagnose fungal keratitis using CRISPR, which we have termed as RIDMIC, which stands for Rapid Identification of Mycosis using CRISPR. So as shown in my previous talk, we had developed this RIDMIC assay, and it had shown excellent diagnostic performance compared to PCR. However, to evaluate its utility as a point-of-care test, we first dissected the assay into the 4 steps. First is DNA extraction, followed by isothermal amplification, followed by the CRISPR reaction and visualization. So this is, we assessed them against WHO's assured criteria for a point-of-care test and saw how well each step aligns with it. So when we did this, 56% of the cost was due to the DNA extraction step. 45% of the time was also due to the DNA extraction step. This was the step which required the most expertise and also was dependent on expensive equipment, and this was the only step which was dependent on electricity. So we thought if we could bypass this step without compromising on sensitivity and specificity to make it an ideal point-of-care test. So there is precedence of direct nucleic acid extraction-free PCR without compromising on the sensitivity and the specificity. So we thought that whether we could apply this to this CRISPR platform. So this is the first step, was to see the concordance or the agreement between these two methods. The first is the DNA extraction based method, where the corneal swab is subjected to lysis followed by a complicated DNA extraction process and requires a centrifuge, where here a regular shimmer strip is placed on the base of the ulcer and directly subjected to RPA amplification and CRISPR reaction. The concordance between these two methods was 100%. The next step was, we wanted to see what is the time to achieve a positive diagnosis. So here, though this is a binary readout, we measured the fluorescence and we looked at the time required to reach the threshold, which was mean of the negative controls plus 3 times their standard deviation. So the mean time to reach a positive diagnosis with the extraction-based method was 23 minutes, while it was 25 minutes with the extraction-free method. There was no statistical significance in these two. So this, encouraged by this, we established the workflow. This is how it works. A shimmer strip placed on the base of the ulcer is subjected to RPA reaction, which happens at 37 degrees. Pipetting and a heat block are the only equipment and expertise which are required, and the learning curve is very simple for this. This is followed by the CRISPR reaction, which again happens at 37 degrees Celsius for 10 minutes, followed by the visual detection. Being on 37 degrees is the highest temperature required. Now we are also we are able to do away the heat block and even work with body heat. So then was the clinical validation. 146 patients with smear positive microbial keratitis were included. RIDMIC was compared with PCR and other conventional micrological methods. So the sensitivity of PCR in this large subset was 93 versus 94.5% with the CRISPR based assay. The specificity was 72 with PCR, 84.62 with RIDMIC. So the concordance with other conventional mycological methods, 72% of the results were concordant between culture, RIDMIC and KOH. 76% between culture and RIDMIC, and 94% between direct microscopy and the CRISPR-based assay. So this was the mycological spectrum of all the fungal species detected by the RIDMIC assay. Fusarium was the most common, but RIDMIC was also able to successfully detect Aspergillus, Curvularia, Candida, Xero, Hilum bipolaris, Lacidodiplodia, and Dementicious fungi. So how does now RIDMIC compare against the other existing diagnostic test for fungal keratitis. So Rhythmic, after microscopy, Rhythmic is the cheapest available. The sensitivity and specificity is comparable to PCR. It is very user-friendly. It requires less than 45 minutes. It requires only a heat block and pipette and does not require electricity to function. So to conclude, again, this is the first CRISPR-based system for the broad range diagnosis of fungal infections in any organ system. First for the diagnosis of any ophthalmic condition. DNA extraction-free Rhythmic reduces the time and cost by half and is not dependent on complicated equipment or electricity. There's 100% concordance between extraction-based and extraction-free Rhythmic. This is a point-of-care test that can be applied at the primary healthcare level. It can be, we are in the process of multiplexing it for species differentiation and for identification of antimicrobial resistance genes. Thank you.
Thank you, Dr. Siddharth. Just one question. You feel that at the primary healthcare level, they'll be able to take the corneal specimen from a patient or the fungal ulcer?
So this is only shimmer strip. So we don't.
But even for a Schirmer strip,
Yes.
for them to be expected to touch the cornea and take it, or is it from the tears?
Tears is sufficient, ma'am.
Okay.
So because
not touching the cornea.
Nucleic acids are present in the tears in a
Okay,
sufficient.
that's
Yes.
understandable.
Yes.
Okay.
One more question. You have compared with the cultures. Have you compared with the KOH mount?
Yes, 94% was the concordance rate between KOH and Rhythmic. Thank you.